Well, millions of Americans traveled over the July 4th weekend. TSA estimates that it screened over 60 million people from Friday through Sunday. And this comes amid the newest wave of COVID-19 infections that appear to be fueled by subvariants of the Omicron strain. So here to discuss is Dr. Celine Gounder. She is the editor-at-large for public health at Kaiser Health News. She's also an infectious disease specialist and epidemiologist at Bellevue Hospital and New York University's School of Medicine. This is a busy woman, which is why we are lucky to have you here, doctor. So let's talk about these new subvariants. I have known people who've recently gotten COVID who didn't get it for the last 2.5 years, and they were really, really sick. I don't know what kind of COVID they got, but so we have these subvariants of Omicron, BA4, BA5. How do they compare to the traditional old school Omicron?
With BA4, BA5, think of them as Omicron number 4 and number 5. These are increasingly immune evading, so they've mutated so much that they look really different from the original Omicron and definitely compared to the original virus, which means that even if you've had a prior infection, even if you've been vaccinated, your immune system has a harder time recognizing Omicron 4 and 5. We are also seeing early hints that Omicron 4 and 5 may cause more severe disease as opposed to, or in comparison to Omicron 1.
Wow. So then is a booster worth it if this virus looks so different?
It's a really good question. And I know a lot of people are sort of like, well, why bother with a booster? What we see with a booster is even if it's targeted at the original virus, it does cause your immune system to broaden the range of viruses it will recognize. And so it does give you a boost right now. That said, the FDA is moving forward with Pfizer and Moderna to produce updated COVID vaccines for BA4 and BA5.
Do you expect to see an uptick in cases with this holiday wrapping up?
We have seen an uptick in cases.
Wow.
Even heading into the 4th of July weekend, we saw an increase in cases. If I had to say, back of the envelope, maybe 1 million cases a day. The key here, though, is enough people are vaccinated. They're not ending up in the hospital as they have before. But this may, in fact, be our second highest wave in terms of infections.
Wow. Okay, let's quickly talk about monkeypox. I expect there's probably going to be an uptick, too, because the way you contract it is through touch. So people were together over the weekend. You were here before Pride festivities because you knew people were going to be together at parades and parties. And so now the CDC is suggesting that if you're a high-risk person, you should probably get vaccinated. But who's a high-risk person if anyone who sort of touches someone who has the virus runs the risk of contracting it?
Right. So anybody, to be clear, can get monkeypox. Men, women, children, anybody can get monkeypox. But right now, it is actively spreading among men who have sex with men, gay men, bisexual men, as well as trans women. So those are the groups, particularly if they've had anonymous sex partners or multiple sex partners in the last 14 days, that are being targeted for vaccination.
Okay. I know when people hear monkeypox, it sounds scary. We see the pictures of people's skin. Does this run the risk of becoming something COVID-like in terms of being widespread?
This is not COVID, to be clear. And so we do not anticipate this is going to be the next big pandemic, landing people in the hospital. But we also don't want this to spread, because if pregnant women, for example, get monkeypox, they can die from monkeypox because they're relatively immunosuppressed. They could miscarry their pregnancy. It can also be really deadly for a newborn. So we really do not want this to become entrenched in the population.
All good information. Dr. Celine Gounder, it's always great having you. Thank you.